What is going on, YouTube family? Welcome back. Today we are going to talk about the most common cause of heel pain, and that is the infamous plantar fasciitis. Let's get started. Hey everyone, if you like this YouTube video, please like and subscribe to my YouTube channel. This helps support all the videos that I make and keep this ball rolling, okay? So diving in, plantar fasciitis can be very debilitating for a lot of patients and extremely frustrating because it has this waxing and waning nature of it. You'll rehab it go away, and really when you get back into what caused it in the first place, it can rear its naked head again, and it can be really annoying. So many times patients walk into my office initially saying, hey look, oh my gosh, when I get out of bed, it is incredibly painful. I have this pain in my heel and it just won't go away. I think I broke something. Many times it's incredibly hard to fracture a bone without some traumatic event, but that's what it really feels like. So that's how debilitating this condition can be for a lot of people. So what is plantar fasciitis and what is the plantar fascia? So the plantar fascia is a thick fibrous band located in the bottom of your foot. It runs from the calcaneus bone, which is your heel bone, to the digits or the toes of your foot. It's responsible for the arch of your foot, and it's also responsible for absorbing all of that shock. So the plantar fascia is an area of the foot. So plantar fasciitis is itis meaning inflammation. It's the inflammation of that thick band, okay? So what can cause that? Many things can cause that under the sun, okay? But I would say one of the most common causes is inadequate shoes. Many times people walk around barefoot. In Florida, where I used to practice medicine, we used to have a lot of people with tile flooring and they would not wear any indoor shoes. So ultimately you have all that compression, okay, of that heel hitting the ground, and that can exacerbate plantar fasciitis. We also see it with people who walk on their feet most of the day, again with inadequate shoes, and we also see it a lot in our runners who do a lot of heel striking and also have inadequate shoes, and that can exacerbate the inflammation. And a lot of times I get the question in clinic of, hey, I've been doing this for years, and now it's popping up, so I must have fractured something or did something. But actually it's really an overuse type injury. A lot of times people don't stretch their plantar fascia, and we'll talk about that a little bit later. So a lot of times that thick fibrous tissue pulls on that heel bone, your calcaneus, and ultimately cause that inflammation or swelling in that area, which is what causes all of that pain. So the question is, how does a MD or a DO or a PA or a nurse practitioner diagnose this medical condition? Many times people want x-rays, they want CT scans or MRIs to discover what it is, but it's such a common injury that we see. It's a diagnosis based on the patient's presentation, okay, so the symptoms that they're having in our exam. If someone's having that classic pain and they don't have that history of, hey, you jumped off of a second-story building on that heel, or you fell on it in particularly hard on a hard surface, and or if you don't have that history of, hey, being a marathon runner and all of a sudden you ramped up your mileage really high and you have a potential stress fracture, barring kind of most of those things, it's a diagnosis that we can do in clinic. There's no x-rays needed, there's no MRI or CT or anything like that. Those type of studies may be done in the future if we're failing other therapies like physical therapy and rest and all that good stuff. But really it's a diagnosis that we can determine in clinic. So ultimately, how do we get rid of this annoying, frustrating heel pain that has not gone away and it's still there? Could have been months, it could have been years, but how do we get rid of it? The first step, as I kind of discussed earlier, is finding the culprit that caused the problem, okay? So if it was running and you're doing a lot of heel striking, maybe you want to see a physical therapist, do a gait analysis, see a professional who can fix your running style, okay? But if you're a runner and you have some poor shoes, not good arch support, again, go see somebody to get properly fitted for some good shoes that can alleviate that problem. If you're the patient that I talked about earlier where they have that tile flooring or they're walking around barefoot on this hard surface, it would be wise to get some indoor shoes that have good arch support. That way you're not causing a lot of that heel striking and compression, that hard compression on those heels, so you can help expedite the healing process. Sometimes we can do anti-inflammatories, but usually you don't need that as long as you're doing all the right things. And then you want to get into a good regimen of not only resting, but also considering ice massage. I usually tell my patients, get some Dixie cups, okay, the small ones, fill them with water, put them in the freezer, freeze them, and then that way you can peel them and do your own massage in that heel instead of, getting a huge ice pack or peas or something like that and put in the bottom of your foot and having to get an ace wrap. But you could also do that, but it's a lot quicker to do that Dixie cup recommendation just because it's faster. And then, like I said, we need to get on a PT regimen, all right? So we need to work on our stretching, okay? Our massage, our strengthening, all right? Those are all aspects of physical therapy that you need to put in your arsenal. And my next video will go into depth on different exercises you can do, different stretching that you can do in order to make this condition go away much faster, all right? And the last recommendation I have, and the most important, is patience. Please practice good patience, because this is something that isn't going to go away in a week. It's very unlikely to go away in a month. It takes devoted physical therapy that is performed on a 3 to 5 day basis over weeks to months to go away. And then ultimately not letting the problem that caused it in the first place to rear its head again, okay? So we don't want to be walking around on that tile floor without proper shoe wear. We don't want to go back to that excessive heel striking when we're running. And we want to make sure that we're changing out our shoes routinely so it doesn't cause pain in the future, all right? Thank you so much for watching this video. Hopefully it was helpful for you to bring a little bit clarity to what plantar fasciitis actually is. If you thought this video was halfway decent, please like and subscribe below to help support my channel and make more of these halfway decent videos, okay? And also, some of the things that I mentioned were different shoes and different physical therapy recommendations in regards to some devices to help. Down below is a comment section of some different things that you could utilize to help recover a little bit faster. And also remember to look at the next video in regards to some physical therapy that will help you get better faster so you can get back to all the activities you love doing, all right? Until next time, thank you so much again. Take care.